is my pleasure to introduce the awardees for the Innovation of the Year, to Dr. Thota Ganesh and Dr. Adam Marcus. Adam's research focuses on cell biology and morphology in lung and breast cancers. Although he does dabble some of his inventions in phone apps, you can ask him about that in his free time. The majority of his studies involve looking into how cancer cells invade and metastasize. Lung cancer, both small cell and non-small cell, is the second most common cancer found in both men and women. In fact, about 13% of all new cancers diagnosed are lung cancers. And although some small cell lung cancer patients respond to frontline chemotherapy, reoccurrence of disease is common and the outcome for patients remains unpredictable. This Innovation of the Year award is a product of years of research and a handful of previous inventions. In order to fully appreciate this Innovation of the Year, let me quickly tell you about one of his previous inventions. This may also serve as a shameless pitch for our tech feed, where this technology and other technologies are also available and can be viewed. Adam and his colleagues have developed a technique that identifies and isolates rare cancer cell types found within tumors that have higher invasive potential than other cells. Through genomic analysis, he has been able to probe some of these unique differences that these invasive leader cells have compared to these less invasive follower cells. Adam has used this technique to screen for drugs that selectively target these leader cells and disrupt the cancer invasion. With the help of Thota Ganesh, a family of compounds has been identified and created and will be assessed in cancer models to identify a lead compound for treating lung cancer. This Innovation of the Year is for Alexidine and analogs. Next one, you guys.
Well, thank you for such a nice introduction. I appreciate it. I promise I won't really talk much about the science, but I really can't help myself sometimes. So I will mention it just a little bit. So this project actually started with very basic cell biology. And, over the course of a few years, we really developed this into a drug development, drug discovery project. And, I kind of thought about, how we ended up doing this, and it kind of echoes what Todd was saying and what Deb was saying in terms of sort of the network here at Emory and the collaborative environment. Just being at Emory, I came in with my PhD in plant cell biology 17 years ago. And being at Emory and being able to basically cross that giant barrier of Clifton Road and reaching out to people like Thota Ganesh over in chemistry to help us do some of the medicinal chemistry here, as well as all the other basic scientists, Plant Fu, over in the drug discovery facility that led to identifying these analogs, were just a key part of the development of this. I would also say being at the Winship Cancer Institute was a game changer for me. The ability to interact with clinicians and work on lung cancer was a complete change for me. So it really has been just an honor and a privilege to be here. I want to really point out and thank some of the people that really made this possible to begin with. One is Rachel Commander, who's here today. She did the drug screen in Dr. Fu's facility to identify Alexidine, and was one of the key people on this project. Also Jamie Arnst, who's here today as well. She also developed some of these analogs for us. And this project actually begun with Jessica Conan, who developed some of the first technology, who's now at MD Anderson. So it's been exciting, as well as the other people in the lab. Lastly, I want to really thank the funders of this technology. So this has received funding from the GRA, also the Coulter Fund, and it's been a privilege working with everyone. And one more lastly, I really wanted to thank working with the Office of Tech Transfer. So I've worked with Cliff for many years, and it's truly been an amazing experience. I've learned a ton, and now working with Sarah has been awesome as well. So thank you for everything you've done, and I appreciate everyone's time here. Thanks.
Thank you very much for bringing me onto this project, and that led me to at this stage. I would really thank you to the OTT for recognizing and obviously on this project. Most of you know that this is not my main area of interest, but it's interesting project. When Adam brought it to me, that antibiotic or antiseptic product that you regularly use in dental clinics as a mouthwash, and you want to develop a cancer treatment, and I thought, wow, there is something we do. Obviously, some of you might know that I am medicinal chemistry background. What I can do is design the molecules that works better than what is already there, or works within a particular target by interacting with. So it's been very great. I know Adam and I have been working on a different project and a different series of molecules. In fact, we published a paper a few years ago. It's really reaching very good citations. But thank you, Adam, and thank you, OTT. I also particularly want to thank OTT for not only for the recognition for this award, but for many other things, like timely receiving our disclosures on a different project, and timely even submitting the provisionals. And I don't want to name here, but Dale has been helping us a lot of ways, and our patent counsel, Jimmy, has been helping in various ways, and other team members. And I'm really grateful to you. And thank you all for giving me this opportunity and giving me the recognition. Thank you.